All right, wellness
Right.
practice achievers. Did you see that view?
What a view, huh?
We are here in Chicago, and we are just doing some masterminding and some training, which I hope all of you do with your good chiropractic friends and your mentors. And I wanted to tell you about a webinar that we're going to be doing on
The 5 strategies or successes to running a wellness practice.
and we are doing this on
August 28th at 8 a.m. Eastern Standard Time.
so August 28th at 8 a.m. So what are we going to be discussing? So we're going to be discussing the 5 strategies of getting better outcomes with your patients. And specifically, we're going to be talking about, first of all, giving people what they want, but showing them what they could have, right? And this was something that we learned from one of our dear friends, Dr. Barry Anderson, and I just love the concept. If I had to capsulize my new patient process, I would say the theme of it is just that. Give people what they want. You know, people don't care how much you know until they know how much you care. And what people care about is why they're coming in. What is their reason for visit? So you've got to be able to give them what they want. Let them know that you're going to help them with their chief complaint. But then I think the beauty is show them what they could have. There's so many people that are chronically diseased, and you can help them and they don't know it yet because you haven't really connected with them on the meds they're taking or the chronic conditions that they're having. So just absolutely critical.
Yeah, you got to be willing to ask the right questions, and that's the critical piece, right? You got to connect with them. You got to show them that you want to listen, that you care about them. But then they don't really understand what it is that the possibilities are and the things you could do unless you're asking them. And that this day 1 process, day 2 process gives you that.
And the second one, so the first one, give them what they want, show them what they could have. Second one is you're going to attract in your practice exactly what you measure in your patients. So we do something called a wellness score to literally give people a grade in 4 dimensions of their health. Their general overall health, their neurospinal health, what we call the chiropractic biomarkers, their functional fitness, looking at their how many pounds of muscle they have on their body, what's their functional movement screen look like, and then finally we also look for some patients, like our 8 weeks to wellness patients, we're looking at their functional nutritional assessment, which is really reflected in their lab work. So again, if you're only doing pain-based assessments like oswestries and x-rays, you're probably going to be limited.
And if you're not reporting back to them 4 weeks out, 8 weeks out, 12 weeks out, you're not running a wellness-based practice, you're just getting rid of the pain. And the wellness score allows you to track that and then report it back to them whenever you need to with different changes in the results so you can show your work and what you're doing is actually working.
Yeah, and to show a patient that their cholesterol come down 40, 50 points in 8 weeks, or their inflammatory markers, or they went from a diabetic to now they're not a diabetic, that's huge.
Life-changing.
So just think about that, not just for them, but also for the doctors that they're seeing, the cardiologists, the internists, the general practitioners that have put them on all these meds. So the second thing is make sure that you're measuring what you want to attract. The third thing is your care plans. And, we see a lot of docs that we coach, they have pay-as-you-go care plans. And in our offices, we have 3-month minimum care plans. Our favorite care plan, we like to say, is an acute care plan in the month 1, followed by 8 weeks to wellness in month 2 and 3. So again, looking at your care plans, and Justin, you said something that I love is if you look at your schedule, right, 3 months from now, and you don't see people that are scheduled, you probably don't have care plans that reflect that.
Right, you should see 80%, 70% of the number of visits that you're seeing today 3 months out. And if you are, then you're scheduling care plans, you're scheduling patients out, you've trained your staff, you've trained your patients that this isn't a come as you go. This is a wellness-based practice, and we have appointments because, and you always say this, if you want to know what someone values, look at their calendar, right? Look at what you're scheduling, and you need to teach your patients that their health has a value and then hold them accountable to making that change.
Yeah, and what if you had a kind of a pay-as-you-go mentality about taking care of your teeth? It wouldn't work too well, right? You only brush your teeth when you had a cavity or when you had some sort of a crisis. So teach your patients that, corrective care, wellness care is an ongoing thing. They're going to be scheduled on a weekly basis or bi-weekly basis for their adjustments, and explain to them the value and the why of that. The next thing is number 4, integrating wellness services into your practice. I know that we get the best outcomes with our patients with the ones that do 8 weeks to wellness. And why? Because they have a structured program around their nutrition. They have a structured program around their fitness. They have a structured program around their mindfulness and meditation. And I will tell you, after practice for 27 years, the people that do chiropractic only plans versus integrating wellness services into their programs, do absolutely the best. And I'm not just saying that subjectively. I can show that with their wellness score.
Right, I totally agree. People need less chiropractic when they're feeding their body right, when they're moving their body properly, and when they're getting, you know, really solid massages and movement with the muscles. We always see better results, and it equals better patient care, better patient outcomes, which your reputation improves, the patient's health improves, and everybody wins.
Referrals improve, everything.
Everything wins.
So the last thing, guys, is number 5 is we want to focus on structure and posture versus focusing on pain and regions of pain. So a lot of chiropractors who, again, have a pain-based practice, they're focusing just regionally on how's your lower back doing today, how's your shoulder, versus focusing on how's that anterior head carriage. Because again, you know, people come in for a reason. If their cue to get an adjustment is pain, guess what happens when you do your great work? You know, their pain goes away, and
Right.
guess what? So does the reason the patient's going to come see you. But if you're focusing on structure and posture, let's take a look at that posture. You still have a little bit of an anterior head carriage. Let's do that posture screen mobile. You still have a 3/4 of an inch of forward head tilt in the high right shoulder. Now the conversation goes from pain to now posture. And we always like to say that posture follows movement like a shadow, and movement is the number one quality, I think, the quality assessment for quality of life. If people are moving into their 60s, 70s, and 80s, and they can squat and bend over and reach up overhead, that improves everything in terms of the quality of their life.
And patients get posture. They understand it. They sit all day, they move differently. And when you explain that an anterior head carriage can cause their low back pain and continue to cause it unless you fix it, it's easy to understand and people get it. You just have to be willing to communicate it and use the right tools in your office to help you communicate it, and the outcomes are amazing.
So guys, again, we're going to be doing this webinar. Please register. The link is embedded in the information that we're sharing here. And get on this webinar because we're going to kind of take a deeper dive into each one of these topics. So you guys have a great day, and we're signing out from Chicago.
August 28th, 8 a.m. We'll see you guys then.